Hello. So today was my transfer, and I wanted to just log in and give everyone an update on how it went. So, in my previous video, I talked a little bit about the preparation for the transfer and just preparing by filling my bladder with fluids. So, that definitely was, I would say, probably one of the tougher parts of the day this morning. So I filled my bladder. I emptied it at first, filled it, took the Valium that they prescribe. We got down to the clinic and got all checked in. We had the nurse that actually was there for the retrieval. She was the same nurse that took care of us today, and so that was nice. Brought us into the room, had us change, both Ra and I, and then the doctor came in. And so the doctor came in and provided us with a little picture of the blastocysts that were the best quality as of today. So the upload from yesterday, I talked a little bit about how we had 7 as of yesterday, but when I talked to them yesterday, they said this is as of Monday. So they don't do like a day 4 review of the embryos. They do a day 3. So today we had 2 that made it to the blastocyst stage, and the rating for them out of the 1, 2, and 3 scale, 1 being almost perfect, 2 being minor imperfections, and 3 being fair. The 2 that we have are fair. So that honestly was a little surprising. And the doctor gave us the statistics there saying, are you thinking you want to transfer 2 or do you think you want to go with 1? And I said, well, my concern with 2 is because of my diagnosis of a unicornuate uterus, will I be able to carry 2 full term? And she said, we don't know, but that's often the case. I think with any twins, like there's always a chance when you're having twins that you can have preterm labor. So that's always a factor. And then now with my diagnosis, my thought is like, I would think that my chances are even more high, but she didn't say that. She did mention that there would be a potential for bed rest and all that kind of stuff. So in the last 24 hours, I've been thinking a lot about 1 or 2, transferring 1 or 2, weighing the pros and cons, going back and forth about, what would 1 versus what would 2 kind of bring to our lives. And so, honestly, when I got to the doctor's office, I had it in my mind that we were just going to do 1. But then when she said that the ratings were 3, I kind of was like, I don't know. But then I thought to myself, remember the cons that we talked about yesterday, remember the cons about the potential for there being just higher risks of things. And I know that having 1 child is a lot of work, and I know that I have a great support system, but I just feel like with all of those factors and just what I can imagine myself, like when I've thought about my pregnancy this whole time, I have not thought about it being twins. And so the doctor asked if we wanted a couple minutes, and I'm like, no, my bladder's full. I just want to go. Let's do this. And so she said, well, the statistics for transferring 1 is 46%, and the statistics for transferring 2 would be 56%. And she said, I'm not trying to change your mind. I'm not trying to sway you in any way. I just want you to know the statistics. If we were to transfer 2, you're concerned about the twins, the percentage statistics for twins, if you were to transfer 2, is 29%. So I looked at Ra and asked him what he thought, and he said, whatever you feel is the best decision, that's what we should do. And so we decided to do one. So then we went into the procedure room, and I was super happy that the nurse that was going to be doing the ultrasound on my stomach and kind of walking us through what was happening down there while it was happening was a nurse that we had before named Heather. And so this nurse on my day 11 ultrasound was phenomenal. So she was the one who was super positive, and it was my grandpa's birthday that day, and he's passed away a few years ago, and so I already was in an emotional state. And then she was telling me like how great things were looking and that my follicles were growing, and I just was shedding lots of tears during that ultrasound, and she was so supportive and so nice and calm and comforting. And so to see her there today and see how excited she was for us and just saying like, I'm so happy for you that you got this far. Great job. And when she checked my bladder, she's like, great job. You did a good job. You drank enough water. So then what they do is the room is right next door to the lab. So there's like a little window in the room that leads to the lab. So then there's the nurse there, Heather was there, and then our Dr. Casey was there. So they explained that they would put the speculum in, do a cleaning of the cervix, and then do a trial transfer with the catheter just to make sure that they find the right spot and all that kind of jazz. And then they would do the actual transfer. So all in all, I would say the whole process took about 4 minutes or so between when she put the speculum in, when she took the speculum out, maybe 5 minutes. And then they asked that you lay in the bed that they did the procedure in for 10 minutes and just kind of wait there with your legs up. And I started panicking after everyone left the room because I could not hold my urine. I had to pee really bad, and I felt so bad. And I tried to get my husband to distract me with playing music, but then he was playing like something upbeat, and I like started giggling and I wanted to dance, and it just was a stressful moment. So I was like, please go get the nurse. So my husband went and got the nurse, and he just said to her, like, she can't hold it. So the nurse says to me, let's just have you go to the restroom. The routine, like the typical practice, is for you to hold it for 10 minutes, but there isn't really like a researched reason that you should do that. That's just kind of what we have everyone do, but you going to the bathroom isn't going to like be a huge deal. So I went to the bathroom and I literally felt like I was going to go to the bathroom on the table. It was like bad. I had to go really bad. And I knew that was going to happen because I have to use the restroom so often. If I drink a bottle of water, I have to use the bathroom like twice. So, and I obviously drink over a bottle of water. So then they put us in a room right after that and just said, just keep your legs up, stay laying on your side or on your stomach and just relax. It's fine. It's okay. And of course my husband asked, like, is that gonna mess anything up that she went to the bathroom? The nurse said no. She went through the discharge instructions with us about starting our medications. I have to do I held my endometrium this morning, so I got to do that now. And then I start the estrogen patches on Saturday, I think. No, Sunday is the 2nd. So I'll keep doing the endometrium, start the patches on Sunday, and do 2 every 3 days. Continue my prenatal vitamin. She marked that I should be taking folic acid, but I think folic acid is in a prenatal vitamin, but I'm going to double check when I get up and go to the bathroom. And then our test, our blood pregnancy test will be done on Friday the 7th. I'm super excited. I am like so happy. So my husband was able to take a picture during the procedure, but he asked if he could record it because on our way to the clinic we called his mom who lives in New York, and she's like, can you guys record it or can you FaceTime me or something? But when he asked, we were told that due to insurance issues and just rules that that's not something that they allow. So they did take a picture of us prior to going into the room. He did take a picture of me when I was laying on the procedure bed. And then they give us this little picture here of the embryo and the sac of fluid. It's right there. And so what that is it's the blastocyst and the fluid around it. And the hope is that it attaches. So it was a great morning. She said to expect to experience some cramping, which definitely during the procedure there was cramping, because they use a catheter, they clean your cervix and all that good stuff. But she said afterward, if I experience any spotting or